The Rural Health Initiative at Auburn University seeks to increase healthcare access for people across healthcare deserts in Alabama.
We deal with a lot of health disparities in rural communities. I think the number one reason why is because people do not have access. There's no hospital close by.
We don't have an emergency or urgent care. After hours, if something comes up, you're going to drive on average probably 30 minutes or more.
OnMed is a state-of-the-art technology solution that we've been utilizing to provide healthcare access for people really throughout the state. What is so unique about OnMed is it is a standalone station. Individuals can get some of the most pressing of their healthcare needs met within that station. It has all of these diagnostic tools fully embedded.
OnMed's partnership, it's what gets me out of bed every day to come to work. The simplicity of the process to just be able to go in and push a start button.
They do all of the intake and fill out the forms for the patient. This is excellent for individuals who may have some literacy or dexterity issues. What we've also appreciated is the Spanish translation.
I am a retired registered nurse, and I have had the opportunity to use an OnMed station. I had a sinus infection that my thought initially was, how are you going to do it virtually? But the nurse practitioner that saw me was a very professional person. I felt a trust between us. She asked me, I'm going to send down a scope and I want you to put it in your mouth. She could look in the back of my throat, and it did not bother me at all that that person wasn't right there in the room with me. She ordered the meds that I needed, and I was able to go to the local CVS to pick those up.
The average length of time people spend in the station is 19 minutes, which is unheard of in other situations when you go into an urgent care or when you go into your own physician's office, even when you have an appointment.
My OnMed experience was fantastic. I do appreciate that it is here.
We're open at non-traditional hours, and you can just walk in. It's really on-demand service. Over 97% of the individuals that go into the care station have overwhelmingly positive experiences.
I see people coming out with smiles and their mouths drop and they say, wow, this is incredible.
We can completely attest to the fact this technology has saved lives. It's actually prevented individuals from having strokes and then sent people straight to the hospital because they went in and they identified how high their blood pressure was.
Well, Tuskegee University now has a custom care station on campus.
If OnMed stations are available as the public needs them, I think it's going to be life-changing.
Our partnership with OnMed is top-notch. I would love to see this in every rural community.
We're thrilled that we're about to be able to roll this out in 4 other communities across the state of Alabama. Our vision for the future is to shift the landscape of healthcare access, and we do feel like we can do this with OnMed as our partner.